Good day, everyone. My name is Justice Edwin Cameron. I'm from the Constitutional Court of South Africa. I'm an old supporter and comrade of the work you have been doing in the Treatment Action Campaign. You have been doing the hard work. I've been benefiting from it. The Treatment Action Campaign was initiated 19 years ago by Zaki Ahmed, and the promise was that life-saving medication should be available to everyone. You should not be excluded from it because you are black, because you are poor, because you do not have access to healthcare facilities, because you are gay or lesbian. Everyone should have it. At that time, many tens and hundreds of thousands of our friends, our brothers and sisters, our aunts and uncles, our parents, our children were dying of AIDS. The Treatment Action Campaign tackled that problem, and it tackled it bravely and strategically and resourcefully. It thought the issues through. It acted with principle. It acted with dedication, and it acted with direction. It tackled the drug companies, and it won. I've been on antiretroviral medication since November 1997, just before the Treatment Action Campaign was started. I have been taking those drugs every day for the last 20 years. Everything I've said is only to say this to you now. Your conference remains important. The TAC remains important to all poor, working class, unemployed South Africans, to everyone in Africa, because the struggles that you undertake have impact everywhere on our continent. Your energy, your focus, your determination, your courage is needed. It's needed because we have a crisis in healthcare. We have a crisis of dysfunction. Many of our hospitals and clinics aren't working. There's still too many stockouts. People aren't getting their medication. There's still too neglectful treatment in many sites of care. And all of this can be remedied. We saw with the other struggles for drug prices and for the availability of antiretrovirals that we can achieve what no one thought we can achieve. We can do this also with healthcare, but at the center is a necessary organization like the Treatment Action Campaign, and the organization needs most of all the energy and the courage and the commitment of you, the delegates. I wish you well.
Dear friends and colleagues, as you are gathered to map out what is the next set of priorities for the Treatment Action Campaign, take time to celebrate the successes we've made to date in terms of the numbers of people we've initiated on treatment and in terms of reduction of infant transmission. But there's lots more still to be done. A biggest challenge facing us is getting people to know their HIV status. Even bigger challenges face us in terms of reaching the remaining people who need to be initiated on treatment, and it's going to require novel partnerships with civil society and strong healthcare delivery systems. But we cannot continue to treat our way out of this epidemic. We have to focus on prevention. We have to find the missing men, initiate them on treatment to reduce transmission to women. We have PrEP today. We have to ensure access to all populations at risk, not just some populations. So I wish you well as you come up with new and novel strategies to further enhance our responses and get us closer to epidemic control.